One patient's journey for Gorlin syndrome diagnosis could be a patient presents with multiple BCCs. Basal cell carcinoma usually presents in their late 30s or 40s, but we certainly see patients at Stanford who have had multiple tumors in their teens and 20s. And the question for the patient and the family is, do I have Gorlin syndrome, and what are the steps that the physician takes to diagnose it? Well, first, it's a clinical exam to look at the histology of the tumors. Are these really BCCs? And secondly, there is a genetic test that your physician can order. And this genetic test is very simple. It can be by saliva or by blood, where a company isolates the DNA and understands and sequences the patch gene to understand if there's a mutation there. If there's a mutation in patch 1, then the patient has Gorlin syndrome. If they have multiple high-frequency BCCs and don't have the patch 1 mutation, well, then they may not have Gorlin syndrome. Other patients, a whole lot of patients actually, threefold more patients have an entity known as high-frequency BCCs. These patients are not Gorlin syndrome, they have lots of tumors, but they don't have that patch 1 mutation, and we estimate this as probably 1 in 10,000 patients. And so sometimes the diagnosis for somebody with multiple BCCs is challenging, and oftentimes if you apply the right genetic test, you can make the diagnosis of Gorlin syndrome. Other clinical manifestations besides BCCs could be these jaw cysts that I mentioned. It also could be other developmental abnormalities such as a large forehead, frontal bossing, calcification of the falx cerebrae, abnormal digits or ribs. There are clinical manifestations that help with the clinical diagnosis of Gorlin syndrome as well.